Okay, so we'll try to discuss two reflexes that are seen in children. Okay, so this is basically, the differences, right? Differences between grasp reflex and also the Moro reflex, okay, as seen in children. So grasp reflex, Moro reflex, okay. So what we have here is there are actually two important newborn reflexes. So they're usually used by doctors because it helps to now access the baby's nervous system. Okay. So what's a grasp reflex? Grasp reflex is also known as the Palmar Reflex. Sorry, this is Moro reflex where the person is startling, like as if they're afraid. But grasp reflex just simply means if you take something close towards the hand of the baby will hold it. Okay. So this is where you place a finger or object in the baby's palm. Okay, and the baby will automatically close their hands to it. It's a primitive reflex. The person is born with it. Okay, so it helps with bonding and also early motor development. For exercise too. So it's present at birth. Usually disappears. Okay, when they're at age 5 months to about 6 months. Okay, absence or persistence shows that there's issues. Okay, within that time range, if it is absent, or after that time range, if it is still present, there's issues. Okay, then the next one which we are discussing is this one, Moro reflex, startle reflex. So what we got here is also Moro reflex, also known as startle reflex. This is when the baby is startled, when there's a loud sound, when there's a sudden movement close to it after some time of being so calm, or if the baby feels like they're falling, they startle. So they throw their arms outward, open their hands, okay, then they bring their arms back together, okay, and sometimes if it is too much, if it is too scary, they cry. So purpose is just a protective reflex. It helps the baby to respond to all those environmental changes. Is present at birth, usually disappears by 4 to 6 months of life. Okay, so this is what we have. Okay, so that's the differences between those two reflexes as what's important to newborns.